everyone. Welcome to another episode. I'm your host, Dr. Smiley. We're shooting another episode with my infamous patient, Mr. Stephen McKay. This patient came all the way from England to seek treatment in almost a whole decade journey of trying to seek health, and he would resent to be highly medicated and going through procedures to put his health back together. I hope that you enjoy the first and second episode. We're on to his journey. This is our third shooting. Stephen, thank you so much for agreeing to sit down here with me. I'm enjoying this, and I'm sure my audience are as well. So first of all, thank you. And the insight has been absolutely great. I know that in the first and second episode, we discovered how your journey has started at the time that you had braces and your life started to turn around. And then you had a whiplash injury and your body started to completely go into destructive zone and you lost your purpose in life. And you got on the road trying to find people that can help you. And you sort of turned into a semi-professional patient. And now you're here in Colorado. How amazing is that? Is that your second or third visit here?
This is my second visit here, and it's been so good.
Yeah. Well, tell us about it, because we brought it out to last episode to where you actually went into treatment with the DNA appliance. And the intent of the appliance was correcting your cranium and alignment of your skull bones, which are all attached to dural meningeal system, running all the way down the spine, through your neck, to your pelvis, and to your toes. And you kind of figured that out on your own from the experience. And you knew that there's only few people who can help you if they know how to hold the fort together to put your dural meningeal system back into moving your lymphatics, spinal fluid into the brain, getting the oxygen and nutrients to the brain, and remove the toxicity. You sort of kind of figured that out, but you had a hard time finding those people that know how to talk to each other properly. Great.
It was very difficult, and it took a lot of research and a lot of browsing through the internet, reading things, reading testimonials, calling people up, emailing people. I mean, I have emailed everyone you can think of when it comes to the cranium, chiropractic, restoring your posture. I've emailed and called most people that you could possibly think of, and through effort, I've ended up over here, and I've ended up finding this wonderful team that exists in this institute and outside this institute that all can talk to each other and communicate and, discuss things, which is an absolute blessing, because we live in a world now where isolation seems to be a priority of most people, and they want to keep themselves to themselves. If they know things, they want to hide it, or they want to keep it behind a paywall, or they want to gatekeep it. And it's really hard to find a team that talks to each other. I really feel blessed. I've come over here and I found that. When you asked about the correction, my occlusal correction that I've started here, yeah, I went through a lot of diagnostic testing, and then you determined that I needed a unilateral block on my right side to take the stress and strain out of my cranium. This was tested over the course of about a week because things changed.
Yeah,
and I got chiropractic adjustments, and then my body was given feedback that I needed a unilateral block on the left side, and the right side was no longer testing strong. And I went through kind of a little bit of unraveling, and my body kind of didn't know where I was. I think my brain, things changed, and my brain was looking for the ground on the opposite side as what we tested. But things have regulated now, and we did confirm that I needed a right side unilateral block, and I've been wearing this right side unilateral block on my upper and lower appliances for 3 months.
And you've been turning the activations to realign your mouth, your upper jaw, lower jaw to your cranium, to the rest of your body. Actively, you've been turning it and changing the dural meningeal tissue, and your body seems to take it well, because you're still seeing chiropractors even back in England since you moved.
Yeah, thankfully we have a better understanding of how the body actually works, and it has to be managed conservatively, and you have to look at the pelvis and look at the feet, and you have to look at the rib cage. And once you have an appliance in, then your your body will give you um, almost perfect feedback
Yeah.
to say that this is right for me or this is wrong for me. And the missing link to a lot of treatment is testing. And in order for someone to be good at testing, now I get great at testing out here between my physical therapist, Josh, Molly. She's a physical therapist, more manual. So she does a lot of manual work on the sacrococcygeal region, the visceral fascia, she does neural manipulation, all of that. So I get a lot of diagnostic testing between the chiropractor, two physical therapists, and you, the dentist. That has been the key to safe and comfortable expansion.
Yeah. And that's really so, Stephen. And then this is really great because you're very familiar with this, but I'm thinking that might be helpful for some of the audience listening. How could even the mouth have that much importance? Because really, what we see in the mouth, the teeth, is a combination of this upper and lower jaw coming together. And most people probably don't know that, in fact, what's upper jaw is several bones that are coming together, and there's a lot of structure that controls that. And you were talking about sphenoid the whole time, and really, I just wanted to take a moment and acknowledge the importance of this one bone and the importance of the bones that are holding our jaw, which most people know as temporomandible joint or TMJ, is that position of these two bones is very relevant into how you orient yourself in 3D. They carry some of the most important neural information. And the relationship of your eyes, because if you think about this bone is holding your eyes. And if you examine the orbit is it's a combination of several bones. The major ones is this cheekbone, the upper jaw, and obviously our frontal bone. And behind is controlled by the position of the sphenoid. So to say that the system is intricate and complex is an understatement. And a lot of dentists say, well, I don't do oral appliances. I don't do, and I'm going to use air quotes saying expansion because you know how much I don't believe in that term. We're going to get into a little bit of that today as well. But they say, well, I don't do any of that. I don't even do TMJ treatment. Why do I need to know that? And I just want to briefly take a moment, and I think you can vouch for that as a patient, that no matter what you do, even if you're doing your normal dentistry, you're changing the trajectory and position of teeth. You are, in fact, changing things in the system and the cranium. And teeth are an extension of the cranium. They are the sutures. You have sutures in all over the bone, the cranium, and the head, which you found had they moved. Isn't that surprising? And they do. And the mouth is the most neurosensory part, teeth, and the most mobile. So what dentist does in the mouth, let's say you put a tooth in a hydrocclusion, your entire body will know about that until all of these bones move and shift, and that tooth gets pushed into the socket, and then the neurology turns off. It's called adaptation. Now, if you have that laxity to take that offense, your body takes a few weeks and you adapt in your neurology, and your eye, the way we gazing our eyes and how we orient our neck will change. And if you have that adaptive capacity, you adapt to it, and then you're symptom free. Symptoms are not coming out of nowhere. Symptoms are frontal cortex telling us that body can no longer take care of this behind the scenes in a subconscious way, automation. And adaptive capacity is reaching the end. It's like your oil change turns on, or your gas gauge says you need to get this taken care of. That's what symptoms are. And it behooves us to know where they're coming from before we turn off the breaker. But unfortunately, when I was a dentist, I would see a broken tooth, and I knew when I see the same teeth breaking several times, you have 20 some other number of teeth. Why is this one breaking every time? Or why is one side of your mouth failing all the time? Those questions is what drove me here. And here we are, you as a patient. And I was tracing down the first episode we did, and you explained your journey in 2019. It's where I started a decade of doing dentistry, noticing those connections. And I knew that there's a lot more to the story of teeth. And my venture wanting to be specialized in TMJ and pain and airway got me to this venture. And one thing you say that I always love hearing is, what a time to be alive. And what a time to be a dentist for me, because I have the pleasure of helping a lot of people in their journey, you included. And I getting to the physiology of things. And you said your health falls apart if your neurology and your orthopedics is not. And mouth definitely is a huge part of it. It's where things come to the collusion, because you have your 2 feet on the floor, you have to stand up, your spine supported by your pelvis, holding your head on the center of gravity. what brings the whole system together are the upper and lower jaw. So the system, the chain closes when the teeth come together and close. And that happens when we swallow. And tell us about some of the neurological and physiological things that happen to you, because I know you've been on that journey as well and discovering how much of your digestion, your hormonal system, and a lot of other things got impacted. And you had to decode a lot of that too on your own, which I learned a lot from you, by the way.
Mm.
So you've been sort of, in a way, leading on the research for me. So I learned a lot. Tell us a little bit about that too.
When you have structural compromise, you can name the symptom. Migraines, headaches, indigestion, acid reflux, low back pain, seizures at an extreme level. Any symptom can come from structural compromise in the body, because we were designed to have relative amounts of symmetry in the body, and I believe the more symmetry that we have, the better our health outcomes are. And if you have ventured away from a more symmetrical structural system, then symptoms arise. And I think the brain only has access to a certain number of symptoms that it can give you. So migraines can have any number of causes, from your feet right up to your upper neck or your cranial bones themselves, but your brain will only give you the symptoms of a migraine. So we only have access to certain symptoms, but the problem could be coming from any structural area of compromise. So that's why it's so difficult to recover, because you could have something going on at one end of the body, but be structurally compromised at the polar opposite side that you have to correct first
Yeah.
in order to make a lasting change. So yeah, I had poor digestion, and I'm not sure about my hormones, but my mood definitely wasn't great. My energy levels weren't great. I didn't sleep very well. I'm pretty sure my hormones were out of whack. And now I'm not a guy that goes massively into blood work and finding out what hormones I have high, what hormones I have low. I don't like knowing all of those things, because I believe that the body is self-regulating
True that.
once you pull out the things that are bothering it. So
True.
if I have a massive amount of knowledge about the level of this, that, and the other in my blood, in my hormones, then I'm just going to add more anxiety, because if I don't know how to correct the root cause, then what's the point of me knowing what's out of whack? Because there's only one way to fix it anyway, and that's through holistic restoration of your structures. And once you know how to do that, I would say then I would be interested in testing my hormones, and then once I'm pretty much symptom free, then I can fine tune the things that I need.
Exactly. And not getting lost in the whole rabbit hole of let's just get this peptide and that testing, because physiology most of the time follows the orthopedic neurology. And breathing is the direct reflection, because your body uses breath as a pulse of the autonomic nervous system, the automation of our nervous system, to orient us, to regulate us, putting things in the background. So you don't have to use your frontal cortex to constantly think about what your digestion is doing. How you're breathing is controlling and reflecting all that, and your mental emotional state. It's just really interesting. You said, that when body is falling apart on one end, the problem could be in the other, polar opposite. That came to me when I was a practicing dentist. I didn't know any of this. And I had a patient telling me they put a foot orthotic in their shoe and the TMJ lock clicking went away. I never thought that that's just in their head. And I knew there was a connection. That took me a long time to understand what that foot to mouth connection is. To just say there's a whole another tier of discovery for a dentist. I'm really excited to be a dentist. To be honest with you, I don't think I would have wanted to be in any other profession. And I work with some of the best clinicians. It's so many different chiropractors with different techniques, and I'm learning something new from each one of them. So many physical therapists that are sensory oriented. They work on viscera, they work on physiology, and propelling that gait, that focuses gait, not muscles, because body incorporates muscles for what orthopedics are not working. And breathing is the center of it. When I declared myself as an airway dentist, I wanted to decode whatever there is that would impact breathing, not just position of the tongue and palate, pushing the lower jaw, and expansion. You and I have the same philosophy when it comes to the word expansion. I think some of the mechanical terms that in my field are being applied to the correct treatment of the cranium is a bit misleading. And I think it would be easier coming from you as a patient who experienced all ends of things, because now you have a device that I gave you that has a screw channel. Now, you've had rapid expansion as well. You've had other similar light wire appliances. I'm not putting you in a spot to tell me which one, you would endorse or not. That's not what it is. I really think it's about not about the tool as much as what the tool can accomplish, right? You agree. And I take pride in knowing and understanding and studying the body. And I wanted to be the first to tell me, why do you think that you, especially children, because you know how I feel about the kids, expansion and orthodontia? Because a lot of parents want to know, do I need to get my kids in orthodontics and that I have crooked teeth? Just provide the patient's perspective here, Steve. I really appreciate if you're speaking from the heart. A patient's been through it since age 10, right?
Yeah. One of the reasons why I came here is because I found a dentist who would look at the relationship of the occlusion compared to the alignment of the cranium. But we know for a fact that the alignment of the cranium is directly connected to the alignment of the pelvis. It's not speculation, it's a fact that there is a system that connects your pelvis with your cranium. So how can a TMJ dentist fix TMJ without knowing or talking or researching about the pelvis? To me, it seems like insanity, because the system is the pelvis and the cranium. In fact, the system is the whole body from head to toe, but there's a big system and a big connection between the cranium and the pelvis. And we know that the temporal mandibular joint is in the temporal bone. Its home is in the temporal bone.
Yeah.
And we know that the temporal bones have a direct relationship with the iliums of the pelvis. So if I'm going to go and get my TMJ fixed, I am going to make damn sure that my dentist understands that there's a direct connection between my temporal bones and my pelvis. And that's why I came here. I don't have to question. I don't have to worry. I don't have to lose sleep. I already know the services that are offered, and I just come and get it. I don't have to worry.
I really appreciate that comment, because one of the things that I called oral appliances, orthopedic appliances, just about anything we put in the mouth, is changing the orthopedics of the body. And the goal of dentistry should be to align the orientation and the relationship of these two arches. I'm going to call them arches, not bones, because there's several bones in the roof of the mouth, and there's only one on the bottom. That left and right is it matters. Left and right matters over here. And when I'm looking at the system, making this neutral or functioning with this is the goal of dentistry. I actually looked into the jurisprudence examinations, which is the test we have to take when we're going to get a licensure in dentistry. And at the time I became a dentist 15 years ago, obviously you're just excited to go out there and make enamel dust. So you just pass through those and take the test. And this time around, I wanted to get licensed in another state, and I had to read that. And the first line opening, the first line of Dental Act is, this is what dentist is responsible for: teeth, periodontal ligaments, and the bones, and all the structure that support them. What are the structures that support the teeth? The entire cranium, the entire body.
Take your pick.
What is the entire system? The whole body is my territory. Mm-hmm. And I thought, okay, so I don't believe that initials really describe what I do. And there is mechanics of treating the teeth. If the body is aligned and if they're in the proper orientation, or perhaps the body can compensate and they can lax into whatever. But I'm dealing with this, but with patients that are becoming, especially children, which is why I want to go back to rapid expansion.
Yep.
Children that are running out of adaptive capacity, we're coming out of the womb with more distortions in the cranium, lifestyles, just about everything is depleted of the neurosensory information for the mouth to properly organize and grow. It's a huge problem. And the tools that we are using is just not even touching the problem at the surface, in some cases making it worse.
I think in 2024, it's become a very popular topic, tongue tie, airway in children. I don't believe that the first port of call for children that are suffering is an expander, because I believe through the birth process and through younger years of being a child, playing, falling, on your tailbone. Any number of things can happen that causes restrictions in the system. And when the system can't pump, or the system can't flex and extend, it can't expand and contract, then we're going to have problems in the face because it's all connected. The sphenobasilar synchondrosis is connected to the sacrum, and they're in sync. And whenever the movement is diminished or it's locked or jammed, which can happen any number of ways through trauma, birth, you name it, then there's going to be deficiencies in the face.
And the restriction of dura. And that, you mentioned this bone sphenoid, which is why this is probably one of the most important key bones in the entire body, if not skull and body. It holds a very important organ called the pituitary gland, right smack in the middle of the sphenoid. So movement and restriction of the dura and the patterns will definitely impede the functionality of this gland. And it's amazing how tongue plays into this. For those that are familiar with, you mentioned tongue tie and myofunctional therapy, and why tongue needs to be at the roof of the mouth, because placement of the tongue at the proper posture at the back of the mouth will impact, positively or negatively, can impact the movement of this bone into getting the whole system into motion. So unfortunately, the science is young and there's a lot of misinformation out there. And one of the goals I have for this podcast is bringing experts, but more important, patients. Everything we say is theory until we see it live in front of us, like we did with you. I watched your 10-year journey becoming shorter than 3 months. We were able to get you as close to homeostasis, to resort back to your own body's ability to heal and unwind itself, back to homeostasis, regulate itself, and putting more into your adaptive capacity. I have seen that real time. Now your hormonal support, now your nutritional support is really benefiting you because we closed the leaks, right? It didn't take the appliance or adjustment or surgery or something very expensive. I think what it really is boiling down to for me is understanding what the body is saying. And what I have observed the last 5 years, Steve, is where you came from and needing the orthodontic treatment is tip of the iceberg. Kids need orthodontic treatment because they have crooked teeth, but not because they have bigger teeth. It's because their mouth is malaligned, underdeveloped, and the skull bones are contorted. And I keep saying that because I really want to bust some myth around expansions and all that theory. Can we help the child immediately breathe? I'd give you this example, and I think you liked it, so I'm going to mention it. So if you have gangrene in someone who's got diabetes and we cut the toe, did we treat diabetes? No, we just cut that toe. If someone has an intracranial pressure, had a concussion, can punch hole like through the skull and relieve the pressure. That still doesn't address where that pressure came from. Same thing goes along with narrow arches, high arch palates, and there's a lot that goes and contributes to it. And what we're doing with just addressing it with expanders, because I saw this adults at 30-some-year-olds that their mouth has relapsed back. So clearly, some of those treatments may have immediately resolved just getting the air through the system, but in my personal opinion, as a professional who's seen this, and your experience definitely has just really solidified this, and similar patients like you, that what we are doing now, there's no backup studies. And unfortunately, our field hasn't grown much since 200 years of doing the same thing, taking out wisdom teeth, doing expansions and orthodontics, and not really looking beyond to the pelvis. And I've had seen kids that gone to the similar treatments ended up with seizure. And that's a real thing. And you think, I'm just expanding their palate or I'm getting them straight teeth. How could that ever be? Right?
It's the Wild West out there. And the fact that young kids even grew up to be a healthy, functioning adult these days is even beyond me, because you have to run through an assault course of potential harmful treatments from the day you're born.
Unfortunately.
And that can come via forced medication, that can come via a traumatic birth and being really, really stuck. A lot of kids are, I have a treatment from some really great doctors who specialize in treating the fascia. So the dural meningeal system, the fascial system, visceral manipulation around the organs. So I've been able to ask them questions and find out why children are developing with crooked teeth and with migraine headaches. A lot of them are stuck. They truly have tissues that are really, really restricted. And whether that's came from chemical trauma, emotional trauma that's passed down from the mother, or whether it's came from physical trauma via traumatic birth, they pretty much produce similar outcomes of someone that can't flourish as they're designed to.
They're short-circuited, right?
Yeah,
The fascia is
yeah.
just really that flow of electricity. It's the flow of or regulating our system and billions of cells in our body to function. For people who are not really that familiar with the term fascia, every cell in our body is surrounded by fascia. Fascia is what's holding our organs together, what holds the muscle and give it the shape. So if you take all the organs and cells out of the body, what's left is the hologram of us, that's fascia. And that's regulated. The electricity, the flow, and movement and breathing is really important for the health of this system. I'm going to call it system for different parts of our body to communicate together. So if there's restriction in any part of that, it could be in the organs that you mentioned at one point. It could be in the cranium from the traumatic birth. It could be from restriction of the cranium with orthodontia, which we had to do a lot of that unwinding in you. And I remember when we were orienting your mouth to the left, one thing we noticed was some particular positions of your lower jaw locked up your system, and you had immediate response of your fluids not moving around your brain, and your sleep was impacted immediately. So we knew that's not right. But unfortunately, a lot of people, like you said, they do know the symptoms, but nobody's helping them navigate through where the symptoms are coming from. I keep going back to the title of this podcast. It took me a while to pick this. And I'm hoping that every time I can make it clear more than I did last time why I picked that title, because to create health, it takes a team. To manage symptoms, anyone can do that. If you're just dealing with the area that you are in, if I had only believed that TMJ problem could be solved with the teeth and teeth treatment, I learned more appliance therapies than I care to admit. And I never really thought any of them could help any patient unless I know how the system works. And here I am telling my story for the world, hopefully to hear. To create health takes a team, and it takes the team include the patient, right? The patient is a huge part of it for me. So, Steve, I cannot be more appreciative of this banter and this talk and discovery. I learn something new from you every day, and I think it helps me to explain all that I know in science easier for people that could benefit from. So I really appreciate that, allowing me to be here and sharing that journey of yours. I know all of us have a journey to get here. Your third decade of life has been, second. Is that second or third? Your third.
Second, yeah.
Second of your decade of your life has been heavily impacted. But I'm hoping that we were able to change that trajectory and finding your gift, sharing it with the world. Thank you again. Any last thing you want to share with our audience? Anything that can resonate with someone as we're reaching the end of this episode?
So one of the big things I learned is there was an old story that I heard when I was younger, and it was an engineer fixing an engine on a huge ship. And he fixed the engine, and nobody could fix it. Nobody had the technical details of this engine, and they couldn't fix it technically. And the guy came in with 50 or 60 years of experience, and he tapped the engine on the perfect spot with a hammer, and the engine roared into life. And he billed the company like $10,000 for a single tap of a hammer. And they asked him, why did you charge us so much money? You only tapped it. He said, it's all of those years of learning and the experience, and I've fine-tuned this process so that I know where to tap, and I fixed it, and that's why I can charge the big bucks.
It goes on saying the nail is 50 cents, where to put it is $10,000, right?
Whenever you're trying to fix TMJ problems, if you have a global and comprehensive knowledge of the whole body, and you end up using a simple approach to the TMJ, that's wonderful. The problem comes whenever you try and fix a TMJ problem, but you don't have the global knowledge of everything else. You need to know where to tap.
Yes, that's 100% true.
So you have a hammer, a splint may be a hammer, an expander may be a hammer, or
adjustment,
whatever.
Yeah.
You've got plenty of hammers, but it's knowing where to tap, and that takes a comprehensive knowledge of the whole body, and that's why I'm here, because I appreciate
I truly appreciate that final landing this on a great note. And it is just a lot we unpacked in 3 episodes. So I'm hoping that, whoever follows us in this one, go back and listen to the episode 1 and 2 of this conversation. And also I reference a few other episodes with other professionals that I've brought in. We reference Dr. Craig Pearson, who's been working with me on this, and you as well. So I'm hoping that the information is useful. If so, smash that share button, have somebody else hear it. So hopefully we can make this a grassroots movement. Thank you for tuning in, and stay healthy.